This week, we have our first guest from the United States on the show, which is very exciting. We'll come to that in a second. Just before that, I have to do a bit of admin, bit of business. So please make sure to follow the show on all the socials, which is at HealthTech Hour. And please make sure to follow the station, which is at UK Health Radio. So today we have Shelby Sanderford, who is the CEO and founder of DOCPACE. Now, DOCPACE, this actually ties in very nicely to last week's show where we had David Ezra from Vantage Health on. It's in the same space of trying to understand how to match up the care that people need with the people that can provide that care in real time. So DOCPACE is one of the leaders in the United States at matching up demand and supply and demand for care coordination. What does that really mean? Well, they're attempting to eliminate waiting rooms at doctors or any kind of point of care or any kind of clinic in order to ensure that people who need to be seen are seen where they need to be seen and when they need to be seen. So, as I said, this is an area that we've covered last week with David, and it was super interesting. We got great feedback from all of our listeners. And so I'm really excited to welcome Shelby to the show. Shelby, how are you?
Steve, I'm doing great. I'm so excited to be here, and I can't wait to dive into this.
Great, good stuff. So as regular listeners will know, the show is split up into three parts. So the first part is sort of an origins part about how you and DOCPACE, well, how you really came to be changing the world. And then the middle bit is all around what DOCPACE is doing right now and all of the innovative, fantastic stuff that includes. And then the final piece, if we get to it, which, you know, depends on sort of all the timing and things, is the future for DOCPACE and other things that we might want to talk about. So let's jump straight in, because I have a suspicion that the last 12 to 18 months has been somewhat transformative for your business. So what's the mood in the camp? You know, how has the last sort of 12 to 18 months been for you and the team at DOCPACE?
It's been quite a roller coaster 12 to 18 months. You know, lots of positives and the fact that we have been able to provide a solution that's been able to help during this kind of crazy time of uncertainty, and, you know, the ability to help staff and patients through this process has been quite rewarding. And then we've also, you know, learned a ton through the transition of just what's happening on the grander scale. And that's helped give us a lot of direction of where to continue to go into the future. Okay.
And obviously you are based in the United States. This is true, no?
Yes, it is. True. In New Orleans, Louisiana.
New Orleans, Louisiana. Good stuff. All right. So I think, you know, we don't have to get into it right now, but I really think it would be of interest to our listeners to understand as we go through these things, you know, what potential, you know, differences in the way that things were handled in the last 12 to 18 months over on your side of the pond versus our side of the pond. And it might be the same way, but I guess we'll sort of figure that out. So first of all, you know, starting with the origins of it. So at what point did you start your journey into healthcare or health tech? How did that kind of come about?
You know, this is going to sound kind of crazy, but it all started with a pair of Tom's shoes.
Okay.
That had this quote, you know, be the change you wish to see in the world. I got them, I think I was like 14 or something, and I wore those shoes everywhere. I was obsessed with them. And it really became kind of my life motto. And it didn't come up until later. I didn't really connect all of this until I was in undergrad studying pre-med, thought I wanted to be a doctor, and actually got introduced to the business side of healthcare during one of my healthcare administrative classes. And I had the opportunity to work in a hospital and really was just exposed to a lot of the internal challenges that the hospital and the administrative side faces. And that quote from those shoes just kept coming back. Like I was seeing what these challenges were firsthand and frustrated by them, and kind of set out on my own mission to be that change and help solve the problems I was seeing around patient satisfaction, wait time challenges, more like operational challenges of coordinating provider time and staff availability and and matching that to patients' needs. So yeah,
Wow.
oddly all started with those Tom shoes.
I gotta say, I love Toms. I have had many pairs of Toms over the years. I'm a big fan of the shoe. I don't remember the quote, but I think that quote actually might be from Gandhi. So you know,
yeah.
yeah. Toms, I hope, you know, I hope Gandhi's estate got some kind of commission for that. But anyway, that's a separate thing. So going back to that kind of like moment when you were doing those internships and things like that, like how clear was it what the problems were, or was it more just a general sense that there was something here, a bit like, well, you know, there are lots of nails here, so I need to go find a hammer type of thing? Or was it like, oh my goodness, this is an epiphany of this particular issue?
I think you know, the pain point and the challenge was there on the surface level, but like the actual root cause has taken years to kind of dig into it and really realize what is actually causing these pain points and these challenges. So when I was actually working in the hospital and seeing those kind of more surface level, those were quite obvious, like patients waiting, and you know, that causes dissatisfaction. And but it was kind of digging into that and really figuring out like, okay, well, what's really causing this and how can we solve that problem? And it's a very complex problem that,
Yeah.
you know, there's lots of different angles and ways to look at it, but that's what we've spent the past 6+ years digging into, really understanding like at the root, what is causing this problem and how can we help solve it.
Okay, well, we'll come on to all of that like as we move through the show. When you went after the internships and things like that, so then what happened then? Like, how did you move from this kind of, oh my goodness, there's some problems here and I'm really motivated to sort of fix them? How did that then sort of evolve into, you know, what's the journey from there to kind of DOCPACE and that type of thing?
Great question. So, you know, I think it was mostly that it just kept coming back to me. Like even after I finished the internship, the whole next semester, I kept like, I was just stuck on this. Like, how do we fix this? How do we make this better for the system as a whole? And it's actually funny because I initially wanted to move to London after undergrad.
Good decision. Great decision.
And that was my plan. And then, you know, because it just kept coming back to me, like, why is this the problem? How do we fix patient satisfaction? How do we make it so patients don't have to wait? And so I just started interviewing people. I just networked with like family, friends I knew, and was asked them questions about this problem. They were all, you know, working in healthcare in some way, shape, or form. And I spent probably 6 to 8 months just learning and asking questions, and then ultimately decided to start the LLC and start building the solution. So,
so like when you say you were asking people questions, like what were the kind of questions that you were asking? Like what, because I'll give you an example. Like there's obviously an expectation in a hospital, if you go to the emergency room, that you will have to wait for some indeterminate length of time, right? So sort of, you know, waiting in a hospital context or a healthcare context is sort of, there's like an acceptance of a certain level of waiting, right? But then after that, it obviously leads to dissatisfaction. So like, what were the questions that you were trying to get? I guess, what were the questions you were asking, and what were the answers you were trying to get out, or the data more importantly that you were trying to extract?
I was trying to understand like the depth of the problem. So one was like, because the problem is a patient waiting that's a challenge for the patient, right? Like the patient doesn't want to wait. So what does that mean for the provider? And how does that, you know, how do you figure out the impact that really has on their day? And so that's what I was, you know, trying to understand, like, is this a problem you're thinking about frequently? How would you solve it? Does it matter to you?
Yeah, exactly. Did you have to go into like, does it matter? Do you care?
Oh, yeah.
Okay. And what was the response on that?
You know, majority of the time was like, I really value my patient's time. I do not
Okay.
want them to have to wait. Sometimes I walk out into the waiting room and I apologize. Like 99% of the time, that was the answer.
Okay.
You know,
We don't
every
need to
now
worry
and then
about the 1%. That's fine. Okay, well, that's reassuring, right? That people care,
Yeah.
you know?
And so, you know, and then the other half of it was like, okay, so do you have a solution for this? What do you do for this now? How do you help solve this problem for your patients today?
Okay.
And it was the things like I walk out into the waiting room and say, I'm sorry, or I have my front office call ahead of time and let a patient know, like, we're running behind.
Okay.
And so, you know, just trying to understand like all the dynamics of this problem from the provider side, not just the patient side.
Okay. I think that's really interesting, and we might be dig into that a little bit more, because I think that's sort of, it's all well and good saying, you know, we want to increase patient satisfaction, but that's really just one side of the issue, because in the healthcare system, unless you can get the payor on board with that, then it's not gonna really fly, right?
Exactly.
And so after you did all that 6 to 8 months of going around doing all your questions, your networking and things like that, then what happened?
Then started the LLC and decided to do the initial version of the product, which was actually a mobile application for patients. So we built this mobile app for a patient to have on their phone, and kind of similar to like Uber app on your phone, where you could, you know, see how far away your appointment was and how long the wait time was the day of your appointment. So spent time developing that, and ultimately ran into a couple of challenges of patients having to give location rights, and actually having to open the app the day of their appointment. So the tricky thing with apps is that if you're not using it every day, then it's a little bit more difficult to get that compliance on like the day of an appointment. So an appointment isn't, you know, maybe you're going once a year, or so you're not using it every day. And so what we ended up doing was shifting to actually the SMS text messaging model, where now all that communication with the patient just happens through SMS text. No downloads are needed. So we eliminated that little hurdle.
Okay, good. And why, and with that initial, you know, Uber type or Uber sort of style app, how did you go about like actually getting the information about the wait times at that really early stage?
Do you mean on the provider side?
Yeah, well, like if you've got the app and the person opens it and it says, oh my goodness, your appointment's been delayed by 2 hours. Is that data that you were able to get from the people that you were working with? Because that's pretty cool.
Yeah, so we had a couple of practices actually local in New Orleans that we were working with to kind of develop that initial alpha version of the product. And how it actually works is we integrate with their existing schedule system or their EMR. And so we pull that data from the system that they're already using, so that they don't have to double input anything. You know, everything kind of happens seamlessly and automated to make that tool as easy as possible for a provider or practice to use.
Cool. And from that alpha version, how did you sort of transition from there to what DOCPACE is today?
I think it's just been, you know, in the startup shoes on this journey, you're constantly iterating, right, and learning from users, getting that feedback, and also adapting to what's happening in the world, and just kind of the direction the healthcare system as a whole is going. And that's what we saw happen a lot over the past 12 to 18 months, was just, you know, analyzing and evaluating, like, how is this shifting our system as a whole, and how can this tool platform fit into that and really play a key role.
And at the time that you sort of started doing this, what I know you said that the people used to come out of their offices and apologize and all that kind of good stuff, but what other option or solution, or like what was the kind of the incumbent, for want of a better word, or what was the alternative when you sort of started doing what you were doing, or sort of like at the beginning, you know?
Mm-hmm. I think that was, that was really it, was having your front office staff call ahead of time. If they knew the provider was running late, they could call the patient and let them know, like, you could show up 30 minutes later. It was more manual.
Really
processes
manual.
like that. Mm-hmm.
Really manual. Yeah.
Really manual.
Yeah.
And
like,
it makes sense because it's very complicated. So there's so many different resources that are, going into a provider and a patient meeting, right? And being in an exam room at the same time. You have staff that has to be available to do the intake. You have to have the patient that shows up at the right time and does their check-in, the insurance, the payment, all of that stuff. You have to have the right number of exam rooms to be able to accommodate the patients. And then you have to have the provider's time sync up with all of that. So there's all these different moving parts, and it's very, very challenging, if not maybe impossible, for a human to just do all of these calculations and figure out all these logistics. Right?
Yeah.
Yes.
Okay.
As efficiently as possible.
Yeah. And so when we can after this, we'll jump into all of the great stuff that DOCPACE is doing, but I just want to kind of ask one more question around how the setup of this sort of happened, which is like, at the time, how kind of supportive or not were, some of the people that you were talking to on either the clinician side or the kind of the payer side about what you were doing? Did they kind of get it from the get-go, or was it a bit of an education process, or like how did that kind of shake out?
I would say it was a pretty good mix. So you always have the folks that are more tech forward and more interested in adopting new technologies, and those folks typically were instantly intrigued and like, wow, this is amazing. And then you always have the folks that are a little bit more technology adverse, and it's mostly just that they're used to their system and their current processes, and maybe not ready to change those.
Yeah.
So I would say, a pretty good mix of both we're seeing.
Okay. And was that like what you expected, or was it sort of one way or the other, like, slightly better than you thought, or like slightly worse than you thought?
It's probably what I expected.
Okay.
I think, it also probably had a lot to do with how their current operations were going. And if, they had certain goals they were trying to achieve and they needed tools and technology to help be able to do that. There's, I guess, more depth that goes into it, but generally it was probably what I would expect to see.
Okay. And from a payer perspective, I know we keep talking about payers, and it's kind of interesting, just for the listeners who, I guess, a large chunk are going to be UK based. So when we talk about payers, the UK payer is effectively the NHS. I mean, there's private healthcare companies and stuff like that, but for the most part, the NHS is the payer, i.e. the money for the services comes from the NHS. And so, but in the US, it's slightly different, right?
Yeah. So the payers would be, could be the employers, the insurance, and then you also have, the patient is paying a portion of that. And I think the interesting thing that we've really focused on as far as how the payers play into this is we do score patient satisfaction, and that helps determine reimbursements for medical insurance. And
Okay,
so
so
that's a
that
very
was,
interesting
yeah, I
piece
was
of
going to
this
ask.
conversation.
Yeah, I was going to ask about that next, which is like, why does it matter to a payer whether patients are happy or not happy? Or rather, why does it matter how long they wait for treatment or not? Like, you know what I mean? How does it? Why does it matter?
And that's because you can be penalized for that, right?
Right.
And I think that gets into another piece of this whole story, is just that there's a lot of components of our system that are more or less misaligned. And that's made it challenging to implement a solution, because you really have to figure out, like, how can we make all of these moving parts and players align and it be incentivized in, you know, a way that's working together, so that they're encouraged to, you know, or motivated to implement that change and follow it. So
yeah, because I mean, I don't know if it's the same way in the US, but like, you know, it's so multifaceted, and it's sort of like any one stakeholder can kind of bring down the whole thing in the sense of a new proposition. So like everyone has to kind of be on the same page for something to get off the ground. And that's one of the reasons for the slower uptake of this stuff than potentially in sort of more of a private space or other sort of industry sectors, is just there's so many people that you have to get all in a line for something to then get adopted. But I don't know if it's the same in the US.
It's very fragmented. No, definitely. And that's a challenge in and of itself, right? But that's ultimately what kind of started this whole idea, was the fact that low patient satisfaction scores actually can be a big penalty for a lot of these health systems and organizations. And that's kind of what first intrigued me in the hospital setting. I was just like, wow, this is crazy. And what's even more wild is that, you know, those scoring surveys are really all based on perception too.
Okay.
So that means, you know, me as a patient, did I feel like I waited 30 minutes or longer?
That's like highly subjective, right?
Yes, exactly.
Right.
And so, you know, that's it makes it more difficult to, I guess, rely on like data that just says, oh, well, you waited actually.
Well, yeah, like
23
exactly.
minutes.
Yeah. Well, I mean, whether I waited 23 minutes or 27 minutes or 32 minutes, I'm still kind of annoyed about waiting, right? And I'm dissatisfied. So, okay, you might tell me it's 29 and I thought it was 35, but like at the end of the day, I'm still kind of upset.
Yep, exactly.
And so, and like, again, it might be a bit too complicated to go into, but I'm guessing that these penalizations for low satisfaction scores are sort of material or meaningful in the sense to these people. They're not sort of just a window dressing. It's actually a fairly meaningful or material issue for insurance companies or whoever the payer happens to be.
Exactly. And, you know, I guess in a way it can give some guidance of, you know, areas to focus on, where to improve, whether you're, you know, that be the provider themselves or their practice as a whole, or the hospital health system. It's, you know, where do we need to focus on actually implementing some change and improving the way that we're operating and doing things.
Okay.
And the wait time is really interesting, because think about when you go to a doctor's visit, it's really kind of the first impression you get, right?
Yeah. Or so like if you go to the hospital and it's like a complete disaster zone, and you know, and you've been waiting in ER, the emergency room, A&E is what we call it, but you know, for 2 hours, it's a horrendous experience.
Yeah, you just start off on a bad note. So
yeah, exactly.
And then that plays into like, well, it's your perception of it. So if that's how it starts, it's very hard to overcome that in the process and shift it. So
did you let's move on to DOCPACE now. And so how would you explain to everyone listening, how would you explain what DOCPACE does and why it matters?
So we are using advanced data science to manage care coordination for healthcare providers. And ultimately, that's to help maximize patient throughput while minimizing patient wait time. Okay. So what does all that mean?
Yeah.
We're using math essentially to match limited resources like provider time, staff availability, room availability with patients' needs, which is just a fancier way of saying that we're matching supply with demand.
Well, yeah, yeah. Okay, and so like, and when you say, because I think when you say it like that, first of all, it makes total sense, but second of all, I suspect it's like a lot more complicated than it sounds. So like, is there some way where you can kind of elaborate a bit on maybe the complexities that are involved so people can get a grasp of like why it's not just as simple as sort of, you know, oh yeah, there's a delay on your thing and you get a notification about the delay to your appointment, right? You know, there's a lot more to it. So maybe you could give an elaboration there.
Yeah, I would love to, because it seems like a very simple problem to solve and would be a simple solution, which is what I thought 7 years ago when I started this.
I love that. Yeah. I like that. That's great.
And you know, it's similar to what we were discussing earlier of like on the surface, it does seem quite simple, but when you actually dig into it and you're like, what's the root cause of this? Why is this happening to begin with? That's very complex. And it's, you know, a lot of the things we've been talking about, there's misalignment and incentives. You know, on the one end, doctors are being kind of forced to try and see more patients in a day. And that causes appointments to get double and triple booked. And then you have patients who get dissatisfied when they have to wait. And then, you know, that's because their expectation has been set by literally every other industry that is like on demand.
Right. Yeah.
And then on top of all of that, you have, okay, well, what does it take to make, you know, to have an appointment happen? You have to match the provider with the patient, have their timeline up, have an exam room for them to go into, and have them prepped and like all the paperwork done. And so you end up with, you know, all these parts of the appointment that have to line up with when the provider is actually going to be ready to see you. And all of that ends up being quite complicated to sync up, just to tell a patient when to, or suggest a patient when to arrive so that they have to wait the least amount of time.
And is it the wait time that you guys have isolated as a really big factor in patient satisfaction or dissatisfaction?
So on most surveys, it's actually the most heavily weighted metric.
Okay.
So that's kind of what we, you know, when I first started looking into this patient satisfaction, how do we solve this? What's the most important parts to focus on? And then that's how I came to that conclusion.
Okay. And what are some of the reasons that contribute? Because I think this area is one of those things where people at first glance, they think they know what it's about. Like I would say I look at first glance, but then I actually think, like you said, there's a lot more going on under the hood. So what are some of those complications or reasons that lead to waiting times? What are the factors that go into that?
Okay, so maybe we can break it down here. A single appointment, let's say it's me going in to see a primary care doctor. There are numerous different parts of the appointment process that have to happen either before I even arrive to the office, once I arrive, up until I'm actually able to see the healthcare provider. And it's all of those parts of the process that don't always get accounted for during the scheduling process. So if you look at how a schedule is done, a typical schedule, we have a pretty standard process we follow here, at least in the States, where a new patient is like a 30-minute slot and a follow-up appointment is a 15-minute slot. And that's just how the whole day gets scheduled out, normally on 15-minute increments. But there's a lot of that that's not being accounted for on the scheduling side. Not saying anyone, I mean, this is, we're doing the best of our ability here as staff scheduling appointments and providers seeing patients. And that's where you can really leverage not only historical data, but some of this advanced data science to be able to understand like all these different components of the appointment and how you can, what we call it, stack them to make the day go as smoothly as possible. Okay. And, that's, if you're talking, let's say it's 7 different parts of the appointment process for each patient, and you're seeing 25 patients a day, like there's no way you could schedule all of that out.
That's a lot. That sounds like a lot. Daily.
Exactly.
Like every daily. Day. Yeah. Okay.
And that's just for one doctor. Like, okay, now what if you look at a practice that has 20 doctors? Yeah. And they're each seeing that. Yeah.
That's crazy. So from the clinician side, or the practice side, or however your sort of customers are, could you walk us through, like, what do they see? Like, how does it kind of, what's the process from their side? So on the face of it, it just makes like total sense.
Yeah. Let me see if I can help give a little visual here. So for the practice, we provide them with a web-based dashboard, pretty typical like SaaS platform, where it's integrated with their existing schedule. So we just pull their schedule each day and run it through our algorithms, and it pretty much spits out like more accurate
so it's like this is like their day. Yeah, so it's like, this is what you said your schedule was, but this is actually really what your schedule is.
Yes, exactly.
Okay. That's cool. That's really cool.
It shows them, and then it also gives them like insights on that dashboard, and it puts the patients in a queue that's like the most efficient way that they could see them, and so that helps basically manage and let them run the practice more smoothly. Okay. And then on the patient side, it's a very similar experience to flight status updates that you get from your airline. Okay. So prior to the visit, actually 2 hours prior, you get a text update, and there's a link in there for our virtual waiting room, which it's basically like an appointment tracker. So up until you're seen, you get we give you this suggested arrival time, and that's when we suggest you arrive to have to experience, or to be able to experience the least amount of wait time as possible.
I think that's awesome. I think one of the things that, for me, like, I always get worried if I go to the doctor, and if I like, generally speaking, I always know that they're always going to be delayed. I mean, there's always like, it's never the time that you think it is. It's just never ever happened, to me, in the history of my life. So but then I get worried.
It's complicated.
Yeah, no, it's super complicated. I'm not like criticizing, right? I'm just, but then I get worried though, because if I don't show up at the appointment time that I was supposed to show up at, do they cancel my appointment, even though I'm still going to wait for half an hour, 45 minutes after my appointment time? So I totally see how this is a massive, massive improvement on that.
Exactly. And you're not alone in feeling that way. Like, I think most patients do.
Okay. And so, like, what's the reaction been, both from patients and also from clinicians to what DOCPACE is doing?
It's been able to really help improve their day's operations, on the staff side, whether that's staff helping in the front, staff helping in the back, the nurses, the MAs, really been able to streamline and improve the communication and the workflow within their operations. And then on the patient side, have been able to reduce their wait times and have them show up. Maybe it's just 10 minutes within when they were supposed to be seen, as opposed to
That's awesome.
30 plus minutes. So
and do you have any metrics or any kind of evidence around sort of like how accurate when someone gets a text message to say, we think that your appointment time is going to be, 3:47 or whatever it is, like how accurate that system actually turns out to be?
Yeah, so the majority of the time we're somewhere in the within that 10-minute range of when it actually is.
That's cool. That's amazing.
It's pretty cool.
Yeah, that's really cool. That's really, really great. I think that's fantastic. And so where is DOCPACE generally, where's your focus right now in terms of the people that you're working with, your kind of target areas?
So we do focus, I guess this is a little bit of a complicated question. So we are integrated with existing scheduling systems, and the one that we're primarily focused on right now is a system called Athena Health.
Okay.
And we're partners with them. We're on their marketplace, and so that's like high level. That's our main kind of focus. And then within that, we do have specific size practices that we target, somewhere in the 20 to 100 provider practices, and typically, these single specialty practices. Although I will say that we are not specialty specific. This works kind of across the board.
Yeah, it's like agnostic.
And it was designed like that. Yeah.
Yeah, it's like agnostic, right?
Yeah, exactly.
Yeah. Cool. Sorry, carry on. Specialties.
Yeah. So we've worked with all sorts of specialties across the board, even urgent cares.
Okay.
And
is that at a hospital level, urgent care, or is that different?
Separate. So we have the emergency room, which is part of the hospital, and then we also have urgent cares, which is to kind of help alleviate some of that patient load on the ER. And it's more of like your common cold visits and that aren't quite emergency, but still need urgent care. So urgent attention.
I see what you mean. So like timely, but not fatal sort of thing.
Yes, exactly.
Okay. And so how is the last 12 months or 18 months? I mean, we've seen it but I'm guessing that there's been a huge transformation in the way that care is being delivered in the States. And so how has that impacted what you would, because you obviously existed doing this before COVID. So how has COVID impacted what you've been doing and what you've been saying in your vision?
So, I think this is a fun conversation, because I think before, a lot of what I was doing was vision selling, right? Trying to share what this vision is of kind of where I see the healthcare system going and the changes that are going to happen. And then now afterwards, you've seen just naturally a shift of this makes sense. This is where,
we need to do that.
This is what we need.
Yeah.
And so, I think that's kind of like the biggest thing that happened over the past 12 to 18 months was just that across the board, you've seen a shift of okay, we need to turn to technology improvements and advancements in order to help us be able to keep up with this, whether it's demand or just the changing environment of, for example, a lot of practices aren't even using their waiting room. They'll have the patients wait in the car.
Wow.
And now you've just introduced a whole new, okay, well, how do we manage that?
Yeah, well, so they're coming out.
What do we do?
Are they coming out into the car park with a clipboard and being is that that's what's happening,
So
sort of thing?
Some will do that, and some will have the patient call when they arrive, and now you've got to have a staff that answers this.
Oh wow. Okay. Yeah, that's crazy. That's that's mad.
Part of what we added to our virtual waiting room was the ability to hit a button when you arrived. So now all those practices, that are having
this is one of the reasons why I love doing this show, because there's so many people out there do coming up with really elegant solutions to really complicated problems that most people think are really simple to solve, but they're actually really not. So I think those problems are the most complicated to solve, but solving them in a really elegant way, I think is brilliant. So yeah, no, I love this stuff. This is great.
And really, I mean, at the end of the day, you have to, because otherwise the user adoption is like so difficult.
Yeah.
Right. Like you have to make it very, very simple and seamless to use. And for us, that's something we've really had to think about a lot, not just on the patient side and what the patient experiences, but how the actual practice uses DOCPACE as well. And making, we're presenting quite complicated data and insights on there, but it's like, okay, well, how do we make this like as simple as possible so that it's very intuitive of what.
Sorry, go on.
And yeah, exactly. So that it's just intuitive of what, it's trying to tell you or help you with.
Yeah, because I think it's sort of like, it's really complicated. There's lots of, data inputs, there's lots of variables, but like it kind of boils down to is it that there's like you're trying to boil it down into a simple set of actions that either the patient or the clinician team can take at any one time.
Right? Exactly.
Right. And exactly. What kind of impact have you seen on patient satisfaction with because it sounds like that was one of the key metrics that you were focused on. And so in the practices or institutions that are using DOCPACE, what's been the patient feedback or the patient impact?
Yeah, so it's been quite positive. We've been able to help those patients alleviate time, which who doesn't love that?
Yeah, that's a winner.
And in some cases it was patients waiting in a line around the block, let's say for an urgent care, and now they no longer even have the line out the door. Right. It's just the patient shows up, goes straight in. Sometimes you even see like from the time you show up to the time you end, you're like in and out in 15 minutes. Like that's the dream.
Yeah, well, that's how everyone else lives their life, right? Like that's every other aspect of your life is basically aligned that way now. I mean, it's sort of, that's like you said at the beginning. I mean, fortunately or unfortunately, every other aspect of people's lives has coached them into thinking that or believing that they can have things on demand when they want, whenever they want, wherever they want, and it's a quick, seamless, low friction transaction, whatever that transaction happens to be. And kind of healthcare, there's got some catching up to do for good reasons, right? There's idiosyncrasies about healthcare and healthcare provision that mean it's, more of a high friction, high touch environment, obviously. But yeah, I think what you guys are trying to do makes total sense, and it's just aligning this aspect of the healthcare system with the rest of the way that people think about living their lives.
Exactly.
And so like with this sort of waiting time issue, particularly where previously they could have been waiting around the block, or they were waiting like, whatever, like relatively a lot longer period of time. Are you guys able to sort of track like the average reduction in that type of stuff? And like, what's the kind of, is there any sort of like key metrics or statistics that you guys like to sort of use to say, well, actually, on average, we save an individual this amount of time versus, where previously they would have spent 2 hours in a line? Or how do you guys think about that?
Yeah, so some of those metrics we're still working on, just kind of compiling all of the work we've done over the past year. But in general, that's kind of what the one that we look at is this 10-minute one. So like typically you're arriving like within this 10-minute time frame of
which is
when
awesome.
you're seen.
Right, because if you arrive within 10 minutes of when you're seen, your average appointment time is no longer than 25 minutes if you're an existing patient, right? If it's a 15, okay. Which is kind of transformative, really.
It is, especially in those scenarios where, sometimes you can end up with these like hour-long waits.
Oh, I mean, it's happened to me in general practice where like, it's not even that urgent. I just have a thing and I just want to go and have the, I don't know what it is. And it's sort of, you end up in there for an hour and you're like, yeah, you can work on your phone sometimes and things like that. But it's sort of like, it took you half an hour to get there, you're in there for an hour, it's like a half an hour to get out, you know, it's like significant.
And that's love the point you just made here, because think about that process you just explained and how much that plays into people wanting to go take care of their healthcare needs.
Yeah.
And that's like a whole another part of this conversation, which we haven't dived into too much yet, but just eliminating those obstacles and any inconvenience of going to the doctor so that people can actually prioritize it more.
Yeah. And like they don't, you know, there's lots of things that you don't necessarily need to worry about, but there's a lot of things that you do really need to worry about and you should go and get seen to. But like, you know, if you're not lucky enough to have you know, if you're not fortunate enough to be in a position where you can, you know, take some time out of your day to go to the doctors, which is the case for millions and millions of people, like reducing a 2-hour cycle time to like 20 minutes, 25 minutes has a transformative effect on their ability to go and get that stuff seen to, I suspect, right?
Exactly. And just making that the whole process that much easier. And, you know, if we're talking more forward looking of where DOCPACE is going, like a lot of our you know, additional features and things we'll add on are all around this kind of this vision of making this process as efficient and convenient as possible for the patient. And then, you know, also always thinking about how to help the provider still meet, you know, what are their goals and the things that they're trying to do as well. But in general, there's a lot of
I was going to say, I mean, I think that just off the back of what you said, I mean, I'm guessing you've already figured this out probably, but like, I think that there's a massive preventative health issue here, right? Which is like, you're enabling people to take preventative steps, as opposed to, oh my God, I can't take 2 hours out of my day. I got to work. I got to do the kids. I got to whatever. Like this enables that person to go and get seen more like earlier on in the process, which from a payer's perspective means the risk of them incurring massive costs as that person's healthcare situation worsens is massively improved, right? You know, if you can get stuff early from a payer's perspective, like all well and good. So I actually think that there's this kind of like this is again why I love doing the show, because, you know, things that on the face of things might seem quite logistic or, you know, however, actually have this potential to massively transform the treatment of preventative diseases and all this type of thing. I think is fantastic.
Exactly. And you know, that's ultimately why, I mean, I that even happens to, I'm guilty of that as well, right? Like sometimes I'll put off certain appointments because I'm just like, I don't know where to fit it in my day. And you know, if I had more clarity on exactly how long it would be, you know, I'd probably be more likely just to stick it in there somewhere on the calendar.
Well, yeah, no, it's how else do people, that's how people run every other aspect of their life, right? Like that's how it works. So I think it's great. So on that kind of topic, what is next over the next 12 to 24 months for DOCPACE? What's on the docket?
So you know, a lot of it will be continuing to expand on our virtual waiting room, and adding additional features in there to continue improving the experience for the patient. So think anything that you can do prior to an appointment to, you know, help speed things up, help things get done ahead of time. We'll be adding those in there. So whether that's, you know, your patient portal, your payment, your paperwork, all that stuff to be done ahead of time. Even, you know, sometimes you can add in, let's say the nurse has to go over certain information with you ahead of your appointment. Like we can add in videos of that ahead of time, all those sorts of things to help streamline that process for the patient. And on the provider side, it's more logistical operational focus. So how can you continue to help them improving the way that they're scheduling patients? A lot of that has to do with providing more analytics and insights and things like, you know, schedule templates and guidelines to follow. we tie all these things together, and we'll just continue to keep improving the experience across the board for both sides.
Good. And have you got plans to kind of, do you think about the US in a geographic sense, or is it more related to working with specific providers and specific institutions and networks and things like that?
I think we look, let me see if I understand what you're asking, just if we work across the board in the US, or
yeah, like the way that you think about how to scale out across the US. Is it sort of like, okay, we're going to do, we're going to do the East Coast, the Middle, and the West Coast, or do you more focus on who the actual providers are and the payers and the insurance companies are and the institutions and the clinic, the clinical networks, and do you sort of build it that way?
Yeah, so most of that is guided by our integrations, and actually integrating with these existing EMRs and schedule systems. And within those, though, we are nationwide. Actually, a lot of that happened post or at the start of COVID, when everything went quite virtual overnight. Yeah. Because we were originally focused on, the New Orleans, Louisiana market, and then quickly had to adapt to doing everything virtually. And so that enabled us to do all of our demos and onboards and setups and everything virtually. And so we can help anyone in the US.
Anywhere. Well, I hope at some point you make the trip over the pond, because I feel like this could really help the NHS at the moment in a lot of ways. So look, Shelby, I think on that note, I just want to say thank you very much for coming on the show. Shelby Sanderford, CEO of DOCPACE. I think what you guys are doing is fantastic. Like I said, it would be great to kind of see something like that in the NHS at some point, because I actually think it would go down really well, not just with the patients, but also with the clinicians. So thank you very much for coming on the show.
Thank you so much, Steve, for having me. This was so wonderful. It's exciting to have these conversations and keep on pushing forward with all these changes, and hopefully that's across the pond one day.
Yeah, absolutely. And thank you everyone for listening, and we'll be back again next week with another great show.